let's try to bring this discussion of race and screening together in a question and discussion. So I guess I'm curious what you think about screening guidelines that address people of different races and ethnicity differently.
Sure.
And then part and parcel of that, has screening exacerbated health disparities?
Certain screening tests have exacerbated health disparities very clearly. There were no black-white disparities in colon cancer or breast cancer deaths in the 1970s. Let me say that again. The death rate for blacks and the death rate for whites in colorectal cancer, both men and women, and breast cancer women in the 1970s was the same. All right. In the early 1980s, late 70s, early 80s, we developed both screening and treatment improvements for breast and colon cancer. You know what they are. The disparities in death rate for blacks and whites all started in the early 1980s. And indeed, the breast cancer disparity is greater today than it has ever been. It didn't exist in 1979, and it's greater today than it's ever been, black versus white. The colorectal cancer disparity in death widened in the early 1990s and is coming closer together now, but there is still a significant disparity. So screening and improvements in treatment do cause disparities because there's a group of people who get it and a group of people who don't. It causes socioeconomic disparities as well. You know, we don't have graphs of poor white people versus middle-class white people, but if we did, there would be a disparity there too. Now, racial guidelines for screening. I tend to want to avoid them because race is a socioeconomic categorization of a population. It has nothing to do with biology. You know, I have a very good friend who happens to be a very good geneticist. He happens to be darker than me and have a broader nose than me. But if you call up Ancestry DNA or Ancestry.com, they won't tell you, but his Y chromosome is all Caucasian. All of it. We only know this because he actually is a world-class geneticist. I have a very, very good friend who's fond of saying, and this is a Nobel laureate, who's fond of saying, to divide the American population into 5 racial and ethnic categories is like trying to slice soup. It doesn't work. And you know, in our racial categories, we lump all Asians together. And it's very easy to see that people from Korea look different from people from India, but we call them all Asian. Right. That's true, by the way, in Africa as well. We in the United States perhaps have too much fog on our glasses to realize that people from Ghana can recognize people from Tanzania, who can recognize people from Kenya. And there's some very big differences there. Now, in terms of racial profiling, this is what it is in prostate cancer. It is true that people who call themselves Black have a higher incidence and higher death rate than people who call themselves white. And it is true that the American Cancer Society, when I was there, the screening guideline actually recommends, again, for informed decision-making, where men know the potential risks and potential benefits and make a decision. And it does suggest that men of African heritage should consider screening at an earlier age, perhaps 45 instead of 50. So yeah, I'm
And
trying to have.
do you agree with that?
I
Despite
am I am comfortable with there are certain populations that we should screen for certain things, and certain populations that ought not get the screen. I am always trying to struggle with how we should define it. For example, there's a genetic mutation that occurs in 20% of people who live within 100 miles of the Thai-Burmese border. And this genetic mutation is such, if you take the very common anti-seizure drug Tegretol, they develop a Stevens-Johnson reaction. The inside of their mouth gets raw, their hands and feet, the palms of their hands start peeling. Okay? It occurs within 20% of people who live within 100 miles of either side of the Thai-Burmese border. This is not all people from Asia. It's not even all people from Thailand or Burma. Okay? Should I profile people from Thailand or Burma to at least ask if they might be from that area, or know if their relatives are from that area before I give them Tegretol? Well, maybe I should just think about another anti-seizure drug first. But there is an appropriate place for what I will call population profiling, and I use the word profiling purposefully.
Mm-hmm. Mm-hmm.
There is an appropriate place. I'm not sure racial profiling is the right thing. In prostate cancer, maybe.
Maybe, well, we can live with.
Well, the Jesuits used to always tell me, always label things what you know, what you don't know, and what you believe, and question what you know more than anything else.
Right. Be honest about what you don't know. So Brianna, back to you for the final question.
Yeah, we're a little short on time here, but for the last question, if you can share what you think about how the Trump administration is applying science. So more so, are you concerned that it has done harm to the reputations of the FDA and CDC as government agencies guided by science?
I am very concerned about science, fact, the scientific method. I should disclose to you that some of the people at the FDA and CDC, those are some of my closest friends. I have tremendous respect for them, and I still have trust that they are going to do the right thing. I am more concerned that so many people in the United States don't understand science and don't understand the scientific method than I am what the administration is trying to do. The fact that they can do it is more of a concern to me than the fact that they are doing it. We have failed to teach people in grade school onward how to think. And unfortunately, we have a whole large portion of our population who've been taught what to think, not how to think. And they don't appreciate science. This actually may very well loop back into some of my issues with screening, or the acceptance of my messages about screening, the acceptance of we don't know the answer to this, so you as a patient are going to have to make a decision about prostate screening or about lung cancer screening. Some of the problems in acceptance of that may very well have to do with people just not accepting science. It's very interesting. When I was at the National Cancer Institute and later on at the American Cancer Society, I found the American people are overwhelmingly supportive of science. And when you show up at an event and people find out you are a scientist, they make you feel like you are a rock star. But I mean, literally.
It's true. Scientists are rock stars.
Yeah, literally. But people don't understand science and they don't want to follow the scientific method.